Welcome back, everybody. Derek Sue, your East Oakland advocate. Well, before we were interrupted yesterday by the AC Transit bus accident, I was actually going to my doctor's office to do two things. Number one, my annual checkup, uh, and then that also reviews what's going on with my cancer, any additional tests that may be needed, things like that. But also, this is the time of year when I get my flu shot. And this year I want to also get the flu shot, COVID, and then once I got to the my doctor's office and got my had to come back for an afternoon appointment. They were able to move me only an hour later. It was because when I actually got to them, they were just about ready to go to lunch, and so they rescheduled me for 12:50, just so I'd be one of the first people being seen right after lunch. But it was a good thing uh, because one of the nice things about having the same doctor for so many years, I've been with the Highland Healthcare Clinic, Alameda Health Systems, since 2010. So I've been with them a long time. That's 13 years right now. And they have all my medical records. And I bring this up because at one time when I was married with my second wife and also operating my company, uh, we used Kaiser. We were payers and insured through Kaiser from not only my business but also my wife's employment with her work, and so we had double coverage with Kaiser, and uh, I can't say anything bad about Kaiser. The time that I was there, I was a patient of Kaiser for mid. I got in there about mid '90s, uh, and then up until 2007. Actually, it wasn't even two. It was 2008 when the divorce went through. That's when my health care for my my second wife expired and no longer was required to pay my bills. But at the time, up until a point, I also had the insurance from my corporation, my company here in, through Oakland, and like I said, I can't say anything bad. Well, I can because I had an accident back in 2003. It was a boating accident, mishap with the anchor chain, and we on that boat, my 26 footer. My wife hit the switch, the powered anchor switch, the wrong way, and literally sheared my finger off. And you can see that. I'm not flipping you off, folks, but you can see where it literally cut the end of my finger right off. It just sheared it right off. It was the body of the anchor as it came over the roller, and it caught me right in between the body of the anchor and the roller, and so I was telling my wife to release the anchor, and instead she pulled the chain tighter, and that's what sheared my finger off. And the thing about being a Kaiser patient, unfortunately, is that Kaiser is an HMO, means that they're a health maintenance organization. And so they don't have to pay uh, outside their network. And in this case, because of the emergency, the closest Kaiser Permanente was in Santa Rosa, which was about 45 minutes, hour away from the hospital that I was already in, which was in Healdsburg, California. But Kaiser said no. Just patch him up, get him so that he can get to us, and we will take it from there. Well, they gave us lousy directions, number one, and so we missed going to the Santa Rosa hospital. And rather, because we had our boat in tow, and my wife had never driven the truck with the boat in tow, so this was a very new experience for her, and I didn't want to expose her too much to the stress of everything besides having to take my butt to the hospital. So anyway, um, long story short, uh, after a year later, after this surgery to reattach my finger was completed, uh, the hospital sent me a notice that, well, we botched your finger job. That's why you have very limited motion with the finger, and they admitted it. They weren't going to pay for anything, but they said, well, if you ever want to fix it and you want to fix it correct, you know, come on back and we'll do it at no cost to you. It's like, oh, you got to be kidding. No, it wasn't a fun experience to go through that the surgery and having it put back on. That this means that they would not only put me out, but they would also take the finger back off and then see what they can salvage and see what they can do. But after this amount of time, it's like, why? So anyway, Kaiser is a good operation. It's just that I did see a deterioration in the way that the administration moves, and that it starts becoming a bunch of bean counters, running the company, and they start uh, profits over people. That's the best way you can say it, is that they choose profits over people, and so they understaff, which seems to be pretty common for all the hospitals these days. I myself, yesterday's experience with the doctor, this was a completely new doctor. My regular doctor, who's now, let's see, the fourth doctor that I've had since I've been with Eastmont Wellness, Alameda Health Systems, uh, Dr. Cartwright has moved up. And so I have somebody who's moving up in the ranks, and she's a nurse practitioner. And the doctor, I have no issues with that. I know many nurse practitioners. This is their way of moving from an RN position and going up into the higher medical field, and even becoming doctors. And so I applaud her for that, and that she is putting in her time and under the supervision of a doctor to intercede if necessary. But anyway, some things were brought up. Some of my previous blood tests showed an elevated cholesterol level, and so um, they're going to put me on a statin, kind of an age-related thing. So looks like, according to my list here, they're going to be putting something like Crestor, Crestor, into my medication regimen. So there's another pill that's added on my daily regimen. Also, yesterday I did another blood test, and they like to do two blood tests, especially with cancer patients, to make sure that the first test and the second test all verify each other out, and they're done separately. But one of the big things that really complicated everything yesterday was the bus accident and the stress it put on my mind and my body, because I I had a feeling that I wouldn't have a good blood pressure reading. In fact, they ended up taking my reading three times in the beginning, and then one more time after uh, at the end of my doctor visiting me, and we actually having our conversation. the nurse practitioner once again took my blood pressure reading, and it was still pretty elevated. And the numbers pretty interesting here because I know what my typical numbers are, but yesterday's blood pressure numbers they never came down, and so that's why they said this is most likely, you know, due to the accident and your body reacting to that, which I 100% agree with. And my blood pressure reading, uh, my average was 142 over 90, so that's really high for me. And typically I'm at 120, 128 to 20, um, and so or 80, I should say, over 80, and I have pretty typical blood pressure uh, levels when I'm on my medication, which I am on. And then so this that accident yesterday threw off uh, doctor trying to verify if my medication for my high blood pressure was good or not, or was still working, and so that complicated that measure. And so, what we're going to be doing, we did all the things that we planned on doing, and we're going to have a recheck up at the end of 30 days. The one thing that was really concerning for me was my pulse. My pulse rate was really elevated. My typical um, resting um, pulse rate is between 63 and 68. In my younger days, I used to go as low as 59 to 60 on my pulse, my resting pulse. Yesterday, my resting pulse was 89, so that's substantially higher than normal. So those were things that complicated yesterday's exam, and it was also important not only for my high blood pressure medication, but also to talk about my shots, because this is the time of year when I typically get my flu shots. I and a lot of folks out there, some of you are anti-vaxxers, and that's fine with you. And the reason why I'm perfectly comfortable with it was because my previous wife, my second wife, was was the attorney for Chiron at the time, and they were going through the flu vaccine shortage because of a contamination problem in their London factory, which produced all of America's flu vaccine. And they were only one of two companies. And so, with them having contaminated flu vaccine back in 2004, that left only, what was that? Aventis Pasteur, the only supplier to the United States. And United States ended up being very short that year on the flu vaccines, but it was quite a fiasco then. My wife went through at that time uh, with that flu vaccine. She was the one that had to fly over to London to be part of the inspections and be part of the solutions, and bring back the information to the board and the United States American government, so that and she worked directly with the FDA. She was had a high security clearance, so that she worked directly with our Food and Drug Administration. So that was my wife. That was part of that, and that's why I'm very comfortable with the flu vaccines, because I know all the processes and how everything works, and the uh, purification and certification processes, how they're all done and how they're carried out. And every year that from 2010 up until last year was the only year that I didn't get my flu vaccine, and I did get sick last year. Last around the holidays, it was just one after another, because it was going between COVID, RSV, the flu, a cold, and then having some of my other issues that I have. But the other things that the doctor talked about was not only the flu shot, which I got, but also updating my pneumonia shot. It had been 5 years since my last pneumonia shot, and they recommend, for me being a senior, that I update my pneumococcal pneumonia shot every 5 years. And so I did. And one of the things that I did learn, because I went in there specifically for the COVID shot more so than the flu shot, because it seems like COVID is more of a worry than the flu. But I said, I like to get the flu shot and the COVID shot. And the doctor, well, the practitioner said, no, you don't. You want one or the other. You don't want both at the same time, because you run the risk of side effects uh, when you do COVID and the flu shot. So that was something that I learned I didn't know before, and I'm glad that I. So I would. They didn't have the COVID in the Pfizer COVID, which is what I specifically asked for, and so they didn't have that in, and they're going to have it for me on my revisit in 30 days, and in 30 days that's when I'll get the Pfizer COVID updated shot. So then what else did we do? Oh, then she said, have you thought about getting a shingles shot? And I said, well, I've already had shingles. And she looked at me. She said, what? I said, yeah, I had it very early on, and I know what brings on shingles. It's stress. And I was highly stressed in a terrible marriage back in, what was that? 83, 1983, 84. I and I divorced. I started the divorce proceedings with my first wife and left her in 1984. So I had shingles for 2 weeks, and it was the most. Besides having a miserable marriage and a failing marriage, and the stress of a mortgage that I was upside down in and couldn't get out of. Um, yeah, I was pretty stressed back then. And so I told the doctor, I know what brings it on. I'm not stressed like that these days. I saw what happened to Mayor Dianne Feinstein, and at her age, she was down for months from shingles, where typically it lasts a week to 2 weeks. Mine lasted 2 weeks. It was most miserable 2 weeks, but I didn't. I actually found having the shingles less miserable than being married, and so that's my memory of shingles. And I told the doctor, no, I don't need the shingles shot. And she did say, you are aware that shingles can come back even though you've had it before. I says, yes, I am aware of that. But one of the biggest triggers with shingles is stress. And so, as a senator, Dianne Feinstein, she's always under stress. Death of her longtime husband, stressful. Also, she was fighting her daughter over the estate of her deceased husband for not paying some bills. So yeah, that lady was under a lot of stress, and that's most likely what caused her shingles. And I don't get that kind of stress these days. But the doctor did say, at your age, it's not so much the stress, but your immunity is not as strong as you age, and so you may want to consider it. And so I don't, that I would think about it, but I don't feel that it's something that would be beneficial for me, given that I know so much about shingles, a lot more than even just a few years ago, having personally gone through it and experienced it. But now you see why yesterday was such an important day for me to get to the doctors, because all of these things had to be done. Also, they had to draw blood so that they can verify all of my numbers and everything from the previous blood tests, and that's just part of aging. And it's that time of year where it gets somewhat difficult to get in because of weather, because the weather starts getting wet, like it's going to start very soon, and especially next month. It starts getting really chilly, so it's much more unpleasant going out and doing errands like this. And so getting them done before the weather gets bad and cold and miserable was important to me. And I, next month I'm not looking forward to going next month because I know what the weather's kind of changing too, but we'll deal with it. And still having some aches and pains from yesterday. I don't know if you saw it, but there's a bruise from yesterday from hitting that, going airborne and hitting the steel supports that support the seats and grab rails and overhead rails. When the bus driver hit the brakes, the air brakes, way too hard, locking up all the wheels of the bus. And the bus was lightly loaded. There were only 5 of us on board the bus besides the driver. All of us went flying. The one who probably appeared to be most damaged was the poor fella that was in the wheelchair up close to the driver. Because when he hit the brakes, not only did he sail out of his wheelchair, uh, he hit his head first. He went head first into the fare box and laid there. And so, and he didn't speak English. That was the sad part. The fellow spoke only French. And parlez-vous français? And unfortunately, there was nobody on board the bus that could speak enough French to hold a conversation or ask him anything. And his English was so limited. Um, it would They had to do a phone relay type of translation. So it was quite a day yesterday. Something that should have only taken me a couple hours to achieve ended up taking me an additional hour and a half, 2 hours to complete. Uh, Nothing that was my fault other than making a bad decision of taking AC Transit instead of my typical Lyft ride. But again, like I said, I was just wanting to save a few dollars, and hadn't used my Clipper card in over a year. So I thought I'd use $2 to save $14, and it didn't save me a dime. Instead, it cost me a whole bunch of more valuable time. The $14 is nothing. It was the value of the time loss that I can't get back. Thanks for joining me today. We'll be right back.